Welcome to this installment of the Community EMR instructional videos, Patient Section Part 1. This video was developed by the WRHA-CSIS team in coordination with EMR users. This video is meant as reference material regarding the functionality of the EMR. Examples provided during demonstration cover various workflows and should not replace any on-the-job instruction provided by on-site supervisors, managers, or directors. During this demonstration, the following topics will be covered: patient registration, navigating through the existing patient records, effective use of the patient tagline, use of patient flag details. Let's search for a different existing patient record. In order to load a new patient record, best practice is to use the shortcut key F1. This clears all previous patient information and allows the user to access the cleared patient fields. Let's search for patient Andrew Armstrong. Begin by typing in the last name Armstrong. Notice that the EMR returns multiple available matches, some in italics and others in straight font. You will notice these two patients have the same FIN number, MHSC, and birth date. They are both the same client. The italics indicate that the patient has provided an alias or preferred name. Selecting either of these options will load the same patient record. We have opened the record for patient Andrew Armstrong and now have access to all clinical notes, demographics, or documents contained in his patient record. Looking at the first tab under the patient search boxes, let's review the information that can be populated in the demographics tab. You will notice green plus icons throughout the EMR application. When selected, these icons provide opportunity for additional information to be added. Looking at the first row, the FIN or Personal Health Identification Number is the patient's personal health number found on their provincial health card. If the FIN structure is accurate, it will display in green. If it is not accurate for the province or state, it will display in red. Any FIN numbers found in red should be investigated and updated appropriately. The next drop-down contains the province and country for Canadian patients, as well as the state and country for American patients. MHSC is the patient's Manitoba Health Services number, also located on the provincial health card. The file number is automatically generated by the EMR and is unique to each client. Other identifiers may be added using the green plus symbol. Here we can add identifiers such as historic chart number or their Canadian services number. We can also indicate if the patient has a paper chart located at the site. Include the clinic name by typing within the open text box. There may be several clinics identified if the client attends other community agencies or programs. Birth date. Wherever you have a date box, you are able to bring up a selectable calendar. Double-click within this box and this calendar will be displayed. Select first the month, year, and then click on the specific date to choose the client's birth date. Please note that Akiro displays dates differently in different areas of the application. Generally, it displays in month, day, year. The calendar therefore becomes the easiest to populate dates due to this inconsistency. Once you have populated the birth date, Akiro will display the patient's age to the right of the calendar. Gender. This lists the gender. Most users have male as their default setting. It is important to always check when registering clients of other genders, otherwise you may accidentally register them as male. The deceased checkbox is used to update upon notification of a client's death. Family physician. This allows you to keep track of the client family physician. Clicking on the ellipsis icon opens a provider search window. This allows you to search and register the physician information to the client record. In this example, Andrew's family physician is Dennis Canners from Plessis Medical Center. To add this to Andrew's chart, I will search Dr. Canners' last name and click on the returned results that match. The referring physician field is not being used for the Community EMR and is therefore grayed out. Alias field allows you to populate an alias for a client. We encourage users to identify the type of alias to accurately identify preference of name when speaking with a client. The green plus icon allows me to add additional aliases if required. For this example, I will add Drew as an additional alias to make it easier to search in the future. It is important to note only the alias found at the top of the list will display within the right side search window. To change the client's alias, use the blue double arrows found at the side of the alias panel. If the client alias or nickname is no longer going to be used, you can delete them. You may have noticed that when you selected the green plus icon, an additional red X icon was added to this section. This is used to delete information within a specific section. To delete an item, first highlight the alias by clicking into the field no longer required, then select the red X to delete. The EMR will ask for verification to this action. If this is what you want to do, select Yes. Address field is where you populate the patient's address. Be sure that the first address listed is the one identified on the Manitoba Health Card. If the client has more than one address, a second address can be added here by using the green plus sign. The address on top is the default address for any forms, labels, or mail going out of Akiro. Email address. This field can be populated if the client wishes his or her email address listed on their chart. Phone number. Populate patients' contact numbers. There is also a short free text box beside each number to allow for extension numbers. At the end of this list, you can also indicate which number is the patient's preferred contact. If additional telephone numbers are required, you can use the green plus symbol and update the client's contact numbers appropriately. Pharmacy contact. In order to populate their preferred pharmacy contact, click on the search icon. This will open the address book and allow you to search for the specific pharmacy. Click on the pharmacy you are looking for. Example, type in Shoppers. Click in the search icon to initiate a search of the address book, and then select your pharmacy of choice. If you click on the star beside the pharmacy name, it will set that pharmacy as a favorite. The next time you are searching for a pharmacy, your favorites will appear at the top of the listing for easy selection. We have now made several modifications within this patient's chart. To save these updates, select the update icon at the bottom of the screen. Office identifies the primary care clinic the patient is attending. Home language. Use the drop-down to choose a language in the event that the patient's language is not English. Official language. This identifies the official language spoken in Canada. Interpreter identifies if the client requires an interpreter during provision of services. Other languages is generally used to identify additional languages spoken and possible interpreter options. Flag details. The patient tagline can be configured to include the flag details. Any details included in this field will display within the patient tagline. This makes it very useful as a communication tool for all sites working with this client. An example would be a patient who has an afternoons only booking restriction. In addition to the details contained within the flag, there are also identification icons that accompany a number of repetitive flags applied to the chart. In this case, our client has the icon for booking restrictions. If wanting to apply additional flag icons to a chart, use the F7 window, selecting the blue New option next to the Flags option. Selecting any of the icons will update the patient tagline display. Ethnicity is not currently required for primary care centers, but is an available option for those sites listing ethnicity. Ensure your clinic has the correct policies in place to request this information from clients. We have made several more modifications within the client's chart. To save these updates, select the update icon at the bottom of the screen. I hope you have found this module on the Akiro patient section helpful. Please see the accompanying presentation patient section part 2 for further explanation of this area of the EMR. For any questions or clarifications, please contact csis_support@wrha.mb.ca.